If I were to try to describe Dr. Simon, and one of the phrases that I did use, which is something that's been used for the University of Chicago, is how it represents, or has always been called, the teacher of teachers. I was, not only as a college student, but again during my orthopedic training here, I really saw this in practice, and I think Dr. Simon walks that walk. It's not something that he simply says. I personally believe that if we're talking about leadership skills in particular, that this is not something that people are born with. I think these are skills that are oftentimes taught to us. And really, Dr. Simon is probably one of the best examples of somebody who not just teaches it, he is somebody to follow. And this is true not just of the fellows, but even the residents that have graduated from this program. I think they really kind of valued that experience, particularly with him.
Dr. Simon told me when we first met that he wanted to educate a cadre of academic orthopedic surgeons who would go out to universities and do this sort of work. And there's no one who's been more successful at that than Dr. Simon. What made Dr. Simon unique was that he was willing to spend the time to work with you personally and professionally to make you the best physician you could be, but also the best husband you could be, the best father you could be. The Orthopaedic Oncology Fellows that Dr. Simon trained wanted to recognize him for the important role he had played in their lives. It was Rex and my job to sort of get people together, but there was no question that all of us wanted to recognize Dr. Simon for all that he'd done for us through the AOA and make him an orthopedic pillar.
I've actually first had contact with the AOA as an ABC fellow in 1983, and I met 6 individuals who were very diverse and disparate backgrounds, and it was a lifelong friendship. Then, as a president, I was a past president, I was fortunate enough to help merge another organization called the Academic Orthopedic Chairman's Group, and with Terry Light, and then the GME, or the Resident Education, came embedded within the AOA, and now has become CORD. I'd actually like to thank Rex Haydon and Terry Peabody. This was a complete surprise. They had a dinner for me with the fellows in orthopedic oncology. And at the meeting, he said, and we've established you as a pillar of the orthopedic profession sponsored by the AOA. It was a total surprise. And it was so thoughtful, as both Rex Haydon and Terry Peabody always are. The AOA is the organization where academic leadership is promoted and enhanced. And indirectly, that helps patients and physicians practice the best orthopedic surgery possible.